Welcome, everybody. Hope you enjoyed that rendition of Baby Shark. That was one of my favorites. It made Baby Shark quite bearable through the early years. See, we have some participants still joining. So, giving you a moment to grab your pencil, grab your paper, grab your questions, because we will have a lot of things to go over today. Welcome to the Full Circle Orientation webinar. My host is going to be sharing their screen very shortly. And so please raise your hand if you're able to see their presentation as well as hear me. All right, I see the hands going up. And so we are going to proceed. Make sure I clear all the rest of my stuff so that I don't have a slow connection today. All right, awesome. Okay, a couple of housekeeping things first. This is confidential, so I will get a report of who attended the webinar later on, but no one else will know that you were here. So please feel free to ask any questions you want. There are no silly questions. And so I will answer them in a way that no one will know that it's you. And if I think that the question is too personal, like too revealing, people might be able to figure out that it's you by it. And I may say, just bring that to your prenatal visit next time. Please participate. Some of you I already talked to a little earlier today, maybe some last week. And I said, bring me all your questions. I love it when you ask me questions and it's not just me talking the whole time. I also have some poll questions peppered here and there to make sure you're still awake and paying attention. And then finally, just by registering, you'll be able to view this for the duration of your pregnancies on our YouTube channel. So we're going to start with a poll question first to just show you how it works. Want to know who's on the line? How many first-time moms do I have? How many mommy veterans are out there? I know I have some dads there too, because I know dads are saying that they wanted to join as well. And I have some information for you all as well. And so this is how the polls will go. I kind of bluff for a little bit, and then I say polls are closing in 3, 2, 1, and when the last votes come in. Oh, we have a lot more mommy veterans, outnumber the first-time moms 2-1 this time. All right, well, that helps me tailor what my next steps are in terms of what we discuss on this as well. So veteran mommies, it's not your first rodeo, but this is a nice refresher because everything you did in your last pregnancy is kind of fuzzy. So we'll go through it and try to make everything clear. All right, so things we're going to go over today include the full circle experience, which includes where we deliver, some office protocols in terms of how to reach us, what to expect at your pregnancy visits. We'll give you some prenatal resources, go over exercise and nutrition in pregnancy, and run through a quick COVID-19 update. Some of my veteran moms had your first babies during COVID before, and so that's your only experience in the hospital, and so you need to know that things are back to normal again. All right, first, a little about Full Circle. We are a collaborative midwifery model practice, which operates under the principle that pregnancy and birth are normal life processes. Some of you came in as our GYN patients, either as mine or Dr. Merrill's or Dr. Mooney's, and so you're thinking, all right, I'm just going to continue on and see Dr. Adams or Dr. Merrill or Mooney for my pregnancy. But we are a midwifery model practice, which means that we are treating pregnancy as normal. So you don't necessarily need a surgeon to deliver your baby. In the traditional midwifery model, we care for normal, low-risk women, but if an abnormality is identified, then you may have to transfer out to a different acuity of care in order to have a physician consultation. In the collaborative model, though, you can stay in the care of midwives for your pregnancy because midwives do pregnancy. That's their thing. But with physician direction in the event that we have some issue, some medical complication with the pregnancy. So to that end, the majority of our deliveries are attended by our certified nurse midwives. But if there is an emergency, if there's something outside of the scope or something abnormal, not even just an emergency, but just abnormal outside the scope of normal labor, an urgent consultation to a physician is always available. If it is urgent, meaning can't wait till morning, but can probably wait about 15 or 20 minutes, one of the full circle physicians will come in. The midwives know exactly when to call us, and we'll come in and take care of the thing that's beyond their scope. If it is an emergency, meaning we do not have 15 or 20 minutes, then we call the OB hospitalist. who are board certified OBGYNs in-house 24 hours a day in order to handle true emergencies. To put it in perspective, there are very few true emergencies. We did 540 deliveries in 2022, and only two of those did the hospitalists need to start moving the patient back toward the OR, but our physicians were in-house by the time baby was born and were able to complete the delivery. Where we deliver, we are now at HCA Florida Memorial Hospital, formerly known as Memorial. Now they call it HCA Florida. We were at Ascension before, so some of you are our veteran mommies who delivered at Ascension. And there is a town hall available on our YouTube channel that addresses why we made that change. So I won't go into great detail on that today, but they're on University Boulevard, which is less than 10 minutes from our office. They are providing tours. In the office, there is information regarding how to get a tour. You just call the phone number and the Director of Women's Services will arrange a time that's convenient for you. They do tours during the day. They do them in the evenings, on the weekends, so that you and your significant other and or family can come and see the place where you're going to meet your little one. I had my first baby at HCA Florida Hospital, and it is a beautiful facility. They offer childbirth education classes, they offer breastfeeding classes, and they offer sibling classes. So veteran mommies, if you're worried about your older brother or sister being an Elmira and love them and kiss them and hug them and squeeze them, this will teach them how to be a sibling that is not dangerous to your new baby that you're bringing home. So there are also, when you give a call there, you can also find out more information about scheduling yourself for some of these classes. How to contact us. Our office is open Monday through Thursday from 9 to 1. We close for lunch from 1 to 2. And then we reopen from 2 to 5. So if you call the office between 1 and 2, you will get the after hours line. There's a reason it's the after hours line and not just a voicemail. If you're having an emergency between 1 and 2, the after hours line rolls over to the emergency on-call person. So if you're having an emergency, please follow the prompts to get to that person. If it's something administrative, like I'm going to be late for my 2 o'clock appointment, or I'm not going to make my 3 o'clock, I need to reschedule it, please don't leave a message for the emergency on-call person regarding that. Just please call us back at 2 o'clock. On Fridays, we close at 1 p.m., so we're open from 9 to 1. So if you are calling with an administrative item on a Friday at 12:53 p.m., please know that we may respond to that on Monday. It's not a holiday, but on Monday. We do not have walk-in appointments. We do appointments, which is how we try to respect your time. Our goal is to see you as close to your appointment time as possible every single time. Ultrasounds are sometimes the exception just because babies don't understand time and they don't always do what you want them to do in the 20 minutes that you've given them. But we don't do walk-ins because people tend to walk in when someone else is already scheduled. And if I've promised you the 3:20 slot, I don't want to have somebody else come in ahead of you and take your spot. It's not respectful to your time. To that end, we have limited same-day appointments. So if you're calling in the morning saying, I have an issue and I need to be seen today, we'll look at the schedule and see what time there is an opening. If the opening is not until the afternoon and you say, hey, I can't wait 6 hours for this, we agree with you. And we may recommend that you go to an urgent care. And it's not us saying that we don't want to see you in our office. It's us saying we agree it is an urgent matter and it should not come and sit in our lobby for 6 hours waiting to get worked into somebody's schedule. For phone calls, providers are unable to leave patient appointments to take phone calls. Again, when you schedule your time with me, that is your time, and no one else has an issue that is more important at that time. Now, obviously, the physicians may be called out for emergency deliveries, but there will always be somebody to swap in and be able to spend that time with you. But if you're calling and saying, hey, I need to speak to Lauren right now, well, she's in the office, she's probably seeing patients, and she's promised those patients that time. We have a nurse here who can take triage phone calls and take messages and give them to us so that we can get back to you when we're finished seeing patients. You also have to leave a message in order to receive a call back. Sometimes people will call and hang up and call and hang up and call and hang up. And we don't know what you wanted or if you're just pocket dialing us. And so we don't call people back just based on what is on our caller ID. You have to leave a message. If you're going to leave it, please leave it in the right place to make sure that we can get your issue addressed as soon as possible. And the right places are on the next slide. So if you're having an issue with with some triage matter, bleeding, contracting, that sort of thing. Tony's taking those calls. She also does forms like FMLA and short-term disability, and she is our triage nurse. We have our OB clinical coordinator, who's Naisha. Many of you have already heard from Naisha. She sent you your cute little baby pictures, and some of you, she's already sent your prenatal labs if you had your OB history visit. If later on in the pregnancy you need a referral, say to the high risk doctor or to someone else, Naisha is the one who coordinates that for you as well. And then at the end, if you need something scheduled, like your delivery, your induction, C-section, or circumcision for the baby, she's the one for that too. And then finally, insurance issues. Anyone who's had their confirmation should have already met with Renee Hall. We typically try to check your pregnancy benefits, and based on what your insurance company says, we try to set some expectations for what your financial responsibility may be. You guys will be pregnant probably over the December to January change. So if you're changing your insurance, please let Renee know as soon as possible so that we can figure out whether or not we're still collecting on an old plan you don't need to pay on anymore, or vice versa. While we go to the next thing, I'm going to just see what this question is. The question is, can I email my FMLA forms to Tony? So they are taking the forms in person so that they can log it. There's a form that you have to fill out in order for them to accept it into the queue to make sure we have all the information before we start filling it out. So we're not having to call you back and say, now what date was this and how long do you want that? So just bring it in at your next visit. That should be plenty of time. All right. There, after hours, there's always someone from our practice on call for our practice, and this is the emergency on-call provider. So remember, this is the person who is also in the hospital catching babies. So she should only be called if you think you need to go to the hospital to perhaps have a baby cot or something of the like. You also have to leave a message to receive a call back. So you just call our regular business number, follow the prompts to get to the on-call provider. That phone will not ring if you don't leave a voicemail. And you'll hear the message on there saying, if you don't get a call back in 20 minutes, call again. If you still don't get a call back, but you think you need to go to the hospital, guys, please come to the hospital. Like, don't have your baby on the bathroom floor because no one called you back. Like, the person who is holding the phone may be pushing with somebody and may not be able to call you back immediately. She might not be able to step away from the bedside, but she's probably at the hospital and would be able to see you there. All right. I'm sorry, I have a lag over here, so you guys probably already see the next screen. So the patient portal is another way to contact us. Please remember that the response times can take up to 2 business days. So the portal is not something where you're going to get a response within 1 or 2 hours. Every once in a while, someone will send a message and it happens to be the time that I'm responding. And they're like, oh my gosh, this portal, you can get a message back in 15 minutes. It doesn't come directly to us, so we have to log in on our own computers to get it. So we may not see it for 2 business days. So if you send something on a Thursday, we might not see it until Monday. You might not get a response until then. If it's a non-action item, we may pass it to the person who's going to see you at your next visit, especially if it's coming up in the next 2 business days. And she'll be able to answer that at your next appointment. And then finally, so a good example of what you want to use the patient portal for, things like, I lost my lab slip. Like, if we gave you a lab slip and you're like, I really want to get my labs done before my next visit, but I can't find it, I wonder if they can email me another one. Or say you have an appointment coming up 3 days from now, but you just tested positive for COVID, so you need to cancel your appointment. The portal is an appropriate place for those questions and comments and concerns. What is not appropriate for the portal is an urgent matter like blood pressure issues. My blood runs cold when I open up my portal and I see I haven't felt my baby move, and I see it was 2 days ago. If you're not feeling your baby move, if your blood pressure is high, if you're having heavy bleeding, that is not a portal message. That is a phone call. That is literally what the emergency on-call provider is there for. Please make the phone call. And if you're not getting the answer that you need, please come to the hospital for evaluation. Please do not send blitz messaging. So blitz messaging is when you send a message and Lauren doesn't answer, so you send it to Dawn, and Dawn doesn't answer, so you send it to Jane, and Jane doesn't answer, so you send it to Cindy. And this is all within like a 2 2 hour period. One, that is portal abuse. And two, multiple messages to one and or different providers will have multiple people working on the same thing, which is not an efficient use of our time. You will get 5 prescriptions for UTI symptoms or yeast symptoms or whatever when it's something that one person definitely could have handled. If it's something that cannot wait for the rest of it for those 2 days, then it may be a phone call. Also, please don't attempt to have an appointment, like an extra appointment over the portal. People will sometimes, now that there's this attachment thing, they'll say, "Oh, I just read this article. Can you take a look at this? And here are my labs from 3 years ago. Do you think this influences my pregnancy? What are your thoughts?" That's an appointment. So the portal is supposed to be the portal is for it's after hours. So we've seen patients all day. We've done all our charting. We reviewed all our labs. And then we look at our portal messages for things that cannot wait until your next visit. If you have questions you think you're going to forget, just text them to yourself or schedule an appointment. We are here every day, and we're happy to see you at one of the appointments to go over whatever it is you have questions about. Other things we send over the portal. So ultrasounds are available they are released over the portal after we review them, unless there is something urgently abnormal on your ultrasound. If there's something urgently abnormal, and our sonographers are very good, they know what is urgent, like what's not okay to walk out of the door. They will come get one of us. This is one of the exceptions where we will interrupt our patient day. And we will bring you into a room, talk about what we saw, and make a plan for it that day. Otherwise, the ultrasounds are downloaded from the machine, uploaded to our electronic medical records, sorted out to one of the providers. When we review it, then we put our commentary on it and send it out to you. So please give us 2 business days to receive them, review them, and release them to the portal. Again, there will not be anything urgently abnormal on there. Other people who have a portal, Quest, they have a patient portal that is very efficient, which is kind of annoying to me because they will send the results to you before they send them to me. You get the results and you see all this red on there and it freaks you out. Remember, red does not necessarily mean abnormal because they use a certain reference range that is not catered to pregnancy. Pregnancy reference ranges are different. They're physiologic changes that allow for your levels to be above or below what a non-pregnant person would have. So give us a chance to receive the labs from Quest, review them, and release them with our commentary. We'll typically say something like, the ones in red are pregnancy normal. They're okay. So if you've had your labs from Quest for over a week and we don't have them, then let us know so that we can ask Quest for them. Please don't send them to us as well because that is duplicate. So we want to get it directly from the Quest interface. So we want to request it from them. All right. Any questions on use of the portal, our office hours, how to contact us before, during, after hours? Cool. All right. Let's move on to the next thing. Prenatal visits. Text yourself questions. Did I mention the text yourself questions? Pregnancy brain is real. Y'all will forget everything you meant to ask me. You'll have a million questions as soon as you walk out the door. Start a chat with yourself, and you'll always have your phone with you so you can refer to that chat as you're in your visit with us. By the time you come in, get your blood pressure checked, listen to baby's heartbeat, measure your belly, go over your labs and everything. And then we say, "Do you have questions?" And it's, "Oh, I did, but I can't remember what it is." Those are not portal messages. Those are text messages to yourself. So please come in with your text messages or your little notebooks. Y'all have these cute little notebooks or like scented paper. So pretty. Wear loose, comfortable clothing so that we can access your belly. It is getting a little cooler. We're moving into Florida winter, but we will still need to see that belly. I think overalls are probably the winter equivalent of rompers. And people come in and they can't figure out how to get their belly exposed. So we need to listen to baby's heartbeat. We want to feel that belly and see if baby is turning into the right position. So please wear something that we can get to the belly. Please arrive a minimum of 5 minutes before your scheduled appointment time. We are not routinely having you leave urine samples. You'll know if you need to leave a urine sample. If we're following you for blood pressures or blood sugars, we'll have you do that. But otherwise, ACOG says we do not need to routinely do it. And we know you are pregnant. You have to go to the bathroom. So come on in, go to the bathroom, stop at front desk, do any insurance stuff, and then that'll give you time to be in the room to see your provider on time. If you're 10 minutes late, we still have time to check on you and your baby, but that obviously leaves little additional time for your questions. If you're 20 minutes late, that is the entire appointment slot. Front desk girls are really good about looking and saying, she's coming, but she's going to miss the 10-minute grace. But there's an appointment on this other schedule, 20 minutes later. So they may be trying to reschedule you as you're walking in. If that doesn't work for you, just let them know. No big deal. We can try to work you in later on in the day, or we can reschedule to a day that works for everybody. But what we don't want to do is have that appointment push back the other appointments for everybody else who's able to arrive on time. It's all about being mutually community respectful. Diagnostic ultrasound visits. How do I know when I'm going to get an ultrasound, Dr. Adams? That is a great question. Diagnostic ultrasound appointments are separate from your prenatal visits. So when you come in for your prenatal visits, those are not ultrasound visits automatically. The way to find out whether it's an ultrasound visit is to look on your portal and see, do you have more than one appointment time, and is there a provider's name associated with your visit? So for example, Tina Test, Tina is our pretend patient. When Tina logs into her patient, we click on the appointment button and Tina sees that she has 2 appointments scheduled. One is at 9:20 with ultrasound, and ultrasound is not a provider's name. And the next one is at 10 a.m. with Dr. Yeckel. Dr. Yeckel is a provider's name. So Tina does have an ultrasound scheduled on that day. She can tell her family to come with her and hang out at 9:20, and they have the option to stay until the 10 o'clock visit as well for the wrap up. Or they can be on their way to go off to work or whatever obligations they have during the day. So if you do not see ultrasound scheduled on your portal, then you are not scheduled for an ultrasound. All right. The results, again, are to be sent to your patient portal within 2 business days, unless there is something urgently abnormal. The take-home message here is that we will not let you leave this building if there is something urgently abnormal. Sometimes you'll see Taylor and Kathleen typing away on their ultrasound, and you'll say, "Oh my gosh, there's something wrong. Let me send a portal message and find out what's on my ultrasound report." The answer is going to be, I don't know, because I don't have it yet. I'll probably have it by the end or midday of tomorrow. But what I do know is that it was not urgently abnormal because we let you walk out of the building. So just know we're not going to let that happen. All right. When you're checking out of your visit and your provider has told you that you need to have an ultrasound, you're due for your anatomy ultrasound or what have you, please let the front desk know. We're sending messages to front desk, but man, sometimes y'all are fast. Y'all are at that front desk before our messages get up there. So let them know, hey, Jane said I need to have my anatomy ultrasound also, to make sure that you schedule 2 appointments, not just your regular OB appointment with one of us, but also an ultrasound visit, so that you'll have a prenatal and a diagnostic ultrasound visit when those are due. Okay. If you think you should have an ultrasound, but we don't think you should because there's no medical reason for it. We have to have a medical reason to code for it, but you're like, but I just want to look at my baby. You can at one of these places. There are boutique ultrasound places all around the city. These are just a couple for informational purposes, not endorsing any one over the other. I know there is one in St. Augustine too, if anyone's down that area looking. But they do cute little things. They put the baby's heartbeat in a stuffed animal and give you all these digital pictures. Some of them do 3D as well. So you can look at your baby as often as you want with no medical indication whenever you feel like it at any of these places. So call them to schedule. All right, we have a poll question now. So how often are you going to be getting these ultrasounds? When do you expect it? And I have a lot of veteran moms on the line, so I feel like this isn't really fair. All right, so we are voting. And the veteran mamas are getting it. I know y'all did hear me say this, not every single visit. Okay. So yes, that is correct. We'll close the polls now. 20 weeks is when we typically do your anatomy ultrasound. And then if there are any problems, which is not routine, because remember the question is, when do I expect routine ultrasounds? So if there's something that's not routine, like we don't see everything that we need to see on the ultrasound, or whatever, we need to follow up on something else, then you'll have other ones. But 20 weeks, and then if you measure well, don't develop any more complications of pregnancy, then we don't need to look again until you pass your due date to make sure that it's safe to continue pregnancy. All right, good job. We are now on our website, fullcirclejax.com. So first thing, we want you to just see this announcement up here. If you did not get a chance to participate in our virtual town hall a few weeks back, it is still posted on our YouTube channel. So you can click the here to watch the event and get all of your questions answered. Great. So this is fullcirclejacks.com. First, we'll start with the providers. So within our midwifery model, it takes a collaboration of physicians and midwives. So the physicians here, there's me. We changed the pictures for those of you who've seen this before. We all went and got new headshots done. So there's me before when hair was more. There's Dr. Marrow. I didn't get a new headshot. I guess you can tell by my hair. There's Dr. Yeckel. There's Dr. Mooney. And then we have the midwives. There's midwife Lauren. There's midwife Krista. There's midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. So one of these lucky ladies will get the opportunity to help you welcome your new little one or little ones into the world. You can click on any of our bios to find out a little bit more about each of us individually. All right, we're going to go over to the patient information portion of here, and you'll see the obstetrics tab. So you'll know you're in the right place because you'll see all the bellies that lead to the baby at the end. Lots of good information on this page. So our delivery statistics, which is why many of you are with us, that and word of mouth, thanks to the friends who referred you, thanks to my veteran moms who are back. Delivery stats. So back to 2018, everything about how many C-sections, how many VBACs, all that good stuff. We're going to click on the prenatal care timeline first. So this is what to expect at each pregnancy visit. So I still sometimes get portal messages, what's going to happen at my next visit? And I send them this link. So all of you have had your pregnancy confirmation visit between 8 and 10 weeks. That's your ultrasound and meeting with a midwife to go over what your due date is, to remind you that this was going to happen, this webinar, and to tell you that your next visit was virtual, which is your OB history visit. If you've already had your OB history visit, then we have or will be putting in shortly some orders for your standard prenatal labs. I'll get patients sometimes that say, I have no idea what labs they ran on me last time. We are very transparent here in terms of what we're ordering. So you can always find what labs you should be having around what time frame. So after your first visit, we'll be getting your blood type, your blood counts, some serologies, a urine culture. And your homework is to try to get that done as soon as possible. Most of you are going to Quest, and I know Quest is a pain in the tuchus in terms of trying to get your lab scheduled, but just do the best you can. Some of you have opted in for the optional genetic screening, which is done after 10 weeks. And some of you have opted for the nuchal translucency ultrasound around 12 to 14 weeks. Also around 12 to 14 weeks, that's roughly 4 weeks after your dating ultrasound, you'll be coming back for a physical exam. So the physical is just a regular physical. Listen to your heart, listen to your lungs, check your belly, check your pelvis. If you're due for a pap test, you have the option of having that done at that time. And the other labs that complete the prenatal panel are the cervical cultures here as well. If you do not want a full pelvic exam or speculum exam, you can just let us know. You can do a self-swab for the cervical cultures. Those of you who need to see the high-risk doctors, this is about the time that you'll be seeing them for your first visit. At this point in pregnancy, we're seeing you every 4 weeks. So about 4 weeks after this visit, you'll be coming back for your second trimester belly check. And that is when we go over usual second trimester issues, talk about starting to feel the baby move for my first time mamas. It's usually sometimes around 17, 18 weeks when you first feel it. Then around 20 weeks, we already talked about your anatomy ultrasound. So that's when we take a look at the brain structures, the heart structures, the long bones, kidneys, all that good stuff. And if baby cooperates, if you didn't do the genetic testing earlier, this would be the first time when you could find out whether or not it is boy baby or girl baby. All right. And then if you are not the type who is able to wait 2 business days to get your results for your ultrasound, I encourage you to make an appointment with one of the midwives on the same day as your anatomy ultrasound. They're able to get a preliminary sheet from the sonographer and go over some of the details with you. If you're meeting with a midwife on that same day or around that same time, she's going to be talking to you about childbirth education or breastfeeding classes and just encouraging you to sign up for some of those things I showed you earlier in the slides. About 4 weeks later is when we're going to be requesting your 1-hour glucose test. And we're going to put a pin in that and come back to it a little bit later. My moms who are Rh negative for their blood type, this is when we're going to be making sure that you have your RhoGAM in-house to be able to give it to you between 28 and 30 weeks. If I have any first-time moms who don't know what that is, we'll explain everything to you. We won't order anything and give it to you without explaining what it's for. This is when we will have you scan the codes or register online for Florida HCA. So it's an online process. You create a portal account with them, and then there are no forms to complete and return to the hospital. You can schedule your hospital tour around this time, and if you plan to work with a doula, this is really when you want to already have her locked in so that she can be in place during your third trimester. Speaking of third trimester, so as we scroll down, then we see that we start seeing you every 2 weeks. So, first time mamas, if you don't have a pediatrician picked out, this is when you want to start looking. Veteran moms, if you think you might not want to stay with who you're with, this is when you want to start scouring to see who your next person is going to be. Your Tdap booster, your flu shot, if you're still within the October to March, and then you'll see in the middle there the option to repeat or decline standard prenatal labs. The Duval County Health Department services all different risk populations throughout the county, and it's recommended to offer a repeat because there are some high risk populations that are more likely to contract STIs during pregnancy. And so, if you feel you are not in that population, we do have a standard form that you can opt out of repeating these labs. I do see a question down here, and here's the do you require the flu vaccine? No, we don't require it. No, we don't require any vaccines. But we say if you're planning to get it, we give you when the optimal time is. So that every 2 week, so for the moms who have any issues with pregnancy, like high blood pressures or high blood sugars, we start antenatal testing around 32 to 36 weeks. For my moms who are anticipating a belly birth, which is our word for a C-section for whatever reason, around 33 weeks is when the schedule for your due date opens up. So if you're planning induction or C-section, normally 8 weeks before we start trying to get our date for the book so that you can start to plan as well. And then at 36 weeks, we do another pelvic exam for group beta strep. And if you've already opted out of the repeat STD screening, you opt out of repeating gonorrhea and chlamydia screening as well. After this visit, we start seeing you weekly and yay, you're full term. So once you're full term, please bring in those birth preferences, those birth plans so that we can discuss it because now you're full term. So all the options are on the table for you. You'll start your natural cervical ripening methods. My belly birth moms will get off the train here. My moms who are waiting for baby to give the signal will begin their post due dates testing. So remember I said if you go past your due date, there will be more ultrasounds. And we are patient. We wait. And we want everyone delivered by 42 weeks. So at 41 and 5 for first time moms, we want to schedule your induction of labor, 41 and 6 for our veteran mommies, just because your labors tend to be a lot shorter. And so we don't have to start so much earlier with you all. All right, so remember this is all out there on the website. You can print this off, you can download it, but it will tell you what to expect at your next visit based on how far along you are. Now, I do have a poll question. If you have a headache during pregnancy, are you more likely to meditate, medicate, or evacuate your house and go to the emergency room? Polls running now. Voting. All right, awesome. Okay, we're going to close the polls in 3, 2, 1. All right, I think the most important thing is we do not have evacuators here, but we have some medicators. Very good. So I've talked to some of you already and you're saying, oh, I have heartburn, I have nausea, I have all these things, but I haven't taken anything because I'm pregnant. So this is my list of pregnancy safe medications. So please, let's open this up. On the left, you'll see the list of common discomforts in pregnancy in alphabetical order. In the middle, you'll see relief measures. So it's not all just medication, but there are some interventions. Like if you send us a message and saying, hey, I'm having this problem. Once we rule out that there's nothing really bad, then we're going to say, all right, try this. Literally, we're going to be going directly off of what's on this list. If the relief measures that we recommend initially aren't working, then we'll say, okay, here's some medications that you can try. What's safe over the counter? You'll also see some things on here we want you to avoid. If you have a cold, nothing with pseudoephedrine, this will raise your blood pressure. If you're having runny stools, there are some things we want you to avoid as well. This goes on to the next page and you'll see some things about cough and cold because 'tis the season. Nausea, vomiting, there's a warning on there. If you can't keep fluid down for more than 24 hours, please let us know because you may need to come in for IV fluids. So you'll just see a bunch of different things on here. And again, just download this or print it out, stick it on the fridge because I promise these are all things you always need at 3 o'clock in the morning. So um, here are your answers right here. Okay, gestational diabetes screening test. We're not going to click on that one, but please remember that it's there because I will reference it a little bit later on in the call. Next, we have weight gain in pregnancy. And some of you are very concerned already, in the first trimester, I haven't gained enough weight. I haven't gained anything. Don't worry, you will. If you look at our table here, this is our recommended pregnancy weight gain. And it's based on what your starting pregnancy weight was. So if you start your pregnancy underweight, you have a different amount that is recommended for you to gain. And you'll see in that last column that your rates of weight gain are in your second and third trimester per week. So don't worry if you think nothing tastes good, I'm not keeping food down, I don't have an appetite. That's okay. First trimester is kind of a haze. And then after that, when your appetite comes back, is when we start measuring what your weight gain should be, because that's commensurate with what baby is gaining as well. If you have twins, you can add 10 pounds onto the high end of each one of these things. All right. There's a link here that you can click on that takes you to the place you can plug in your height and weight to get your starting body mass index to know how much you should be gaining during pregnancy. Next box is our birth preferences. So this is where your birth plan is born. So early on in the practice, we were seeing a lot of birth plans. They've kind of dissipated over the years as people have just kind of figured out who Full Circle is and what we do. But sometimes writing some things down can help to decrease your anxiety and improve your communication with the nursing staff, and the people who come to support you as well. So a lot of stuff on here, for everything from how you want labor to start to what you want to wear in labor. Pain relief measures. I want to highlight a couple things there. Of course, it is a hospital, so there are epidurals and there's IV pain medicine also. But hydrotherapy, my host is reading my mind. Hydrotherapy is on there as well. We do have tubs available for labor. It takes about 26 minutes to fill up the tubs. So while you're doing your admission stuff, as you come in, they can be heating up that tub for you, and they are nice. They're so comfortable. We also have nitrous oxide, the laughing gas they have at the dentist too. You can't do both of those at the same time, but those are two alternative pain relief measures for those who are trying to avoid epidural anesthesia. There are other things on here. You can just see we don't strap you to the bed. We don't starve you. We do have wireless monitors so that you can move around in different positions during labor. We encourage pushing in different positions, delivering in whatever position is most comfortable for you. Our standard is perineal compresses and warm compresses to try to avoid tearing. I've probably cut 5 episiotomies in the last 22 years of practice. So it's definitely nowhere near our standard. Our standard is delayed cord clamping and immediate skin to skin. The nurses there are trained in basic latch. You'll also see some of the medications that are routinely offered to the newborn. There is opportunity to come in and ask the midwives, hey, what is this medication? What is this for? Is this, does my baby need this? Does this apply to me? And we can talk through what the evidence is behind any of those. Down here, you'll see circumcision, breastfeeding, and all that other stuff. Also, if I have twin mamas on the line too, you have options for whether for your deliveries as well. And we talk through the nuances of twin delivery too. And my belly birth mamas, remember, this is the place of gentle cesarean. So it's not, if I do a vaginal delivery, I get everything I want. I do a C-section, I lose all of my options. Gentle cesarean is a thing that Full Circle has, a phrase that we've coined that still keeps it a family-centered experience, so that we remember it's not just a surgery, it's a birth. All right, so it might seem overwhelming, all of these boxes here, but there's 21 boxes, and most of you have at least 21 weeks left in your pregnancy. So take it one box a week, and not every box on there is going to apply to you. So there may not be, you won't have to look at all the boxes. After that 36-week visit is when you want to bring those in to start talking. So, other things about after the 36-week visit, with the exception of one thing on this list, cervical ripening techniques. At some point, you want this baby to come out. You spend all the pregnancy trying to keep baby in, and then finally you're like, get out. So, at 20 weeks, you can start raspberry leaf tea. To help tone the uterus. Now, none of these things are designed to put you into labor, but designed to soften the cervix, get the uterine muscles toned so that when labor does start on its own, it's more efficient. Most of them start 36 weeks plus. So you can see things on here like acupressure, acupuncture, chiropractic care, evening primrose, clary sage, dates, breast pump. They're all on here. The one except castor oil. Castor oil is not on here. And if you ever have a visit with me, you can ask me why, and I will tell you. But everything else is on here, and you can just see week by week what we recommend in terms of preparing your body physically for labor, for baby to give the signal for labor to start. All right, back to the main presentation. The next thing is for my first time moms and my trial of labor after cesarean. How many moms do I have on the line who've had a C-section before and are going for a VBAC, vaginal birth after cesarean? I know it's not my first time moms. Okay, all right, got it. Polls are closed. Okay, yes, you are going to rock it. Yes, you are. All right, this is advice for you. And first time moms, listen up. This is advice for you as well, because you and my VBAC mamas are trying to do the exact same thing, avoid an unnecessary C-section. So we cannot control what the baby does. We cannot. Even after they come out, we can't control what they do. They're 18 years old, can't control what they do. But these are things that you can control what you can. So if you, VBAC mama specifically, are struggling with your previous birth experience, please talk to somebody so you can let that go. Don't let that sabotage your current birth experience. You remember you're with a new practice that has a different supportive view of vaginal delivery. For my first time moms, everything else on here applies to you. Method specific childbirthing courses, yoga, Pilates, squats, getting a doula, getting your baby in the right position, only gaining the appropriate amount of weight during pregnancy, avoiding a non-medical induction. This is my big thing for first time mamas, because my first time moms at the end, you're like, I don't care, I'm tired, get the baby out. And if you do not need an induction, that may, because of baby's position, increase your risk for having a C-section. So let your baby decide when he or she wants to come. Trust us and trust you, because we all want the same thing: safe, healthy mama and good birth experience with happy memories. All right. So please remember that this is out here for everyone. And then lastly, on this page, circumcision care. We do not do these at the hospital. These are done in the office before little guy is 10 days old. So we'll ask you right after delivery if you plan for circumcision for him. And if so, we'll reach out to Naisha, our OB coordinator, and she will send you a message with his little appointment time. All right, so these are all the resources that are on Full Circle Jacks. Please remember that this is out there, and we are headed back to the presentation where I feel attacked, because those of you who are, now some of you are also saying the opposite thing. Dr. Adams, I'm first trimester and I'm gaining so much weight already. I don't know why I'm only drinking coffee in the morning. Are you? Or are you drinking one of these salted caramel mocha monstrosities? That's so yummy. And that's with 2% milk. Holy cow. All right. So just keep an eye on these calories, because did you know that it only takes 300 additional calories per day to support a pregnancy? It takes 10 calories to maintain 1 pound of body weight. And so we've already discussed that your pregnancy goal weight gain is based on your starting body mass index. So if you're starting the pregnancy at, say, 170 pounds, it takes 1,700 calories to maintain that. If your goal weight gain is 25 pounds, then that's an additional 250 calories for a total of 1,950 calories per day. If we divide that between breakfast, lunch, and dinner, that is 650 calories per meal. That's food or drink. Baby does not know the difference. So if you're like, I had a great 650 calorie meal, and then you wash it down with a 570 calorie mocha monstrosity, we're towing the line, sis. Towing the line. All right. So these nutrients, this nutrition fact panel here, flip things over. It's kind of amazing in a terrible way how much sodium, how much sugar, how many calories are in so many things, and just small changes, small choices can make a big difference in our pregnancy weight gain and are retaining water, developing hypertension, all of those things. So this gives you a nice breakdown of your carbohydrates, your protein, and we'll talk more specifically about protein in just a moment. But remember, this slide is out there on our YouTube channel as well for you to come back and refer to. What things should I be eating? Fruits, veggies, whole grains. You're not going to give your baby an allergy to nuts or dairy. So if you like those things, go ahead and eat them. For my coffee drinkers, you want to keep your caffeine less than 200 milligrams per day, which is actually like 3 or 4 cups, which is still a lot of caffeine. So remember, caffeine is a diuretic. Use the 3-to-1 rule. You want to have 3 times as much water as you do caffeinated beverage when you're drinking anything caffeinated. Herbal teas are fine. Our favorites for pregnancy are raspberry leaf, ginger, lemon, and peppermint. For my workout queens, my bodybuilding ladies who are eating a lot of protein, or for those who are just having trouble keeping anything down and need protein, your sweet spot you want to be around 70 grams per day. Too little protein, you get these growth restricted, underweight, scrawny little babies, and way too much protein, you get these 10-pound Michelin man fluffy babies who don't want to come out. So 70 grams per day is plenty. Please and thank you. Deli meat, yes, you can. As long as you microwave it for 30 seconds ahead of time, you do not need to eat it piping hot out of the microwave. Do not burn your mouth, but you need to kill the bacteria. So 30 seconds of microwaving makes it safe for you. For your soft cheeses, as long as they're made with pasteurized milk, that's okay as well. If you're someplace like at a restaurant, you can't verify that it's with pasteurized milk, skip it that night. But Trader Joe's and Publix, you can flip it over and see what the milk situation is. Canned tuna, you may have 3 of the 4-ounce cans per week, which I think is a lot of tuna. But if I don't know your life, maybe you need more tuna than that. Maybe you need other fish. If you need other fish, here's the FDA government, the FDA.gov website that has information about eating fish in pregnancy. So this gives you the fish that you should be eating a lot of because they're high in DHA, which is good for baby's brain development. Those you can eat sparingly, and those you should avoid due to methylmercury content. So it's like a 2-page document. I'm not going to put all that on here, but just know if you are a pescatarian, this is just for you. You're welcome. Things to avoid: undercooked fish. So if your fish, if you're having that yummy ahi tuna, so delicious, not during pregnancy, please. You're going to have to wait until after pregnancy is over for that. The medium rare steaks that are also so delicious. So nope, you're going to have to ruin those for the next 6 months or so and make them well done. For my kombucha drinkers, my kimchi eaters, those are fermented food and beverage, and your body treats fermented things in forms of alcohol. In the same vein, alcohol. We don't know how much alcohol is actually safe in pregnancy, and so we cannot recommend a safe amount for you. So we recommend avoiding it. And sodium. I start getting messages in third trimester saying, I can't fit my rings anymore. And my feet are swelling. They won't fit into my shoes. And the first question I'm going to ask is, how much sodium are you eating? So limiting to 1,500 milligrams per day. Again, flipping your food over and making wise decisions on that. All right. Any questions about food before we move on to exercise? Okay, so this is a quiet crowd. Okay, this must be, this is where you're going to come alive. Exercise in pregnancy. It is okay to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. You just won't feel like it in the beginning. So just give yourself and your body a break. In your second trimester, you'll have some physiologic changes. You increase your blood volume by 50%, and that helps you do more of the aerobic activities that you're used to doing. Just listen to your body. If you're not the Olympiad athlete that you were before, you'll get back to it in your second trimester. No, don't beat yourself up. The question that I have out there is protein shakes. Yes, just keep it to 70 grams. That's all. That is the only restriction on that. Enjoy your protein shake. For those who are not doing much of anything so far in pregnancy, please start doing something. The most common reason that I do C-sections is not because the baby is too big. It's not because the baby is in distress. It is because the baby is malpositioned, meaning that the straight head is actually crooked in the pelvis and can't come out that way, or the baby is sunny side up. And there are exercises and movements mom can do to make sure that baby rotates to the proper position. The sedentary lifestyles lead to malpositioned babies, lead to cesareans, gentle cesareans, but cesareans. Those of you with these cute little Fitbit watches and you're monitoring your heart rate, giving yourself more anxiety about that, you'll notice that your resting heart rate will rise between 10 to 20 beats per minute at rest. That is normal. That is physiologic. There's nothing you need to do about that. That's an adjustment your body is supposed to make to accommodate circulating for two. All right, so exercises. Exercise is working in the aerobic zone. So the aerobic zone is 70% of your maximum heart rate. And that calculation is done by starting with 220 minus your age. So let's say you're 30 years old, you start with 220, you subtract 30. So your max heart rate is 190. You should not be exercising for extended periods of time with a heart rate above 190. 70% of 190 is 133. So if you are walking with a heart rate between 133 and 190, for 30 minutes, 3 times per week, then your walking is considered exercise. Because some of you say, oh, yeah, I exercise a lot. I walk a lot. Well, me too. I mean, I walk from one patient room to the next one, but my heart rate is not 100 and none of your business. You don't even know how old I am, but my heart rate is not that high. And so that's not actually exercise. It's transportation, but it is not exercise. So your goal is to exercise in the aerobic zone 3 times a week at a minimum. Get that heart rate up. How? Cardio. You can do treadmill, you can do elliptical, you can run outside, you can do swimming. Swimming is actually one of my favorites, and it's cold. You guys can find a heated pool. Those are like your joints are weightless. It's actually really nice for pregnancy. Indoor biking. If you're on Peloton, my leaderboard name is Off My Meds 8. If you follow me, I do follow back. We can keep each other honest with our blue dots on the board. You all have been really inspiring to me, so please join the crew. Weightlifting, you can lift whatever you're lifting up to pre-pregnancy level. No need to increase resistance. Your baby and your body will do that. Squats are my favorite. Please build up to at least 50 squats per day. If you're already an experienced squatter doing more than that, carry on. If you need to get started, start at 20 weeks. You're going to do 5 squats a day. 21 weeks, 10 squats a day. 22 weeks, 15 squats a day. When you work up to 50, they don't have to be all at once. I mean, they can be, but you can give me 25 in the morning when you get out of bed and 25 right before you get back into bed at night. Pilates and yoga are also two more of my favorites. Any exercise that stretches and makes you think long and lean muscles. And any experienced yoga or Pilates instructor will be able to tell you what the appropriate pregnancy modifications are for that. What you want to avoid, high intensity interval training after your first trimester. It's not the interval, it's the intensity. You can do the low impact versions of these exercises. Anything that has you lying flat on your back for extended periods of time, like excessive ab work. Standing abs are fine, side lying abs are fine, just not lying on your back for a long period of time. Hot yoga, unless you are a hot yoga instructor and are fully acclimated to that environment, you will get dizzy and you will fall. And I don't want you to fall on your belly. Other things to avoid include scuba because of changes in barometric pressure and decreased oxygen to baby. Same thing with high altitude hiking. You may visit your family in Colorado, but don't go hiking with them, please. Contact sports, please do not take up kickboxing at any point during this pregnancy. And outdoor biking after 16 weeks is kind of with an asterisk. That's just when your center of gravity starts to change. So just be very careful if you're going to be biking outside, that as you're turning the corner, you're not leaning too far into it because your belly will pull you over to the side and you'll end up on the curb instead of going around it. And the question is, what is considered a long period of time? Oh, hold on. Sorry. Let's see the question. What's considered a long period of time for lying on your back, generally speaking? More than 60 seconds, like prolonged being on your back. All right. Now that we've talked about nutrition and exercise, can you prevent gestational diabetes with good diet and exercise? I'm going to take a sip of my water while you all debate this. Is that true? Is that false? My veteran mamas know me well. We're closing the polls in three, two, one. It is false. You cannot prevent it with diet and exercise. That's the key word, prevent. So remember that block we did not click on the website, gestational diabetes screening. So I'm going to refer to that in just a moment. We screen everyone universally for gestational diabetes because of your hormones. Any other time outside of pregnancy, believe that your hormones may be off. Guess what? During pregnancy, there are hormones too, and they can be off as well. Your placenta gives off hormones that tell your insulin not to do its job. And insulin's job is to clear your bloodstream of glucose. And so if your insulin is not doing its job, you have excess glucose circulating, and that is the definition of gestational diabetes. It is not a judgment on your lifestyle, has little to do with your family history, your weight, your eating habits. It's your hormones. It is your hormones. So if you can figure out how to do this pregnancy without a placenta, I will not screen you for gestational diabetes, but I don't think you can. So we do universal screening for everybody. For my moms who say, but I don't eat anything that has sugar in it, you eat good carbs. So don't avoid them prior to the test. Eat your fruits, eat your whole grains and things of that nature. If it is the actual drink that bothers you, we have options for that. So the Simply Pure drink is available for purchase in our office. It is soy-free, it is dye-free, it is gluten-free, it is BBO-free, it is kosher, it is vegan, it is offensive to almost no one. There are a couple of other patient-driven options that are on our website. The fresh test is one, glucoorganics is another, and then there are glucose tablets that you can get as well. If you are doing those tests with some option that is not at the lab, then please let us know because Quest is not accepting outside drinks. We won't be able to send you to Quest. You'll have to go to LabCorp or BioReference. And we'll need to write it on your lab slip that you're bringing your own drink and go over the rules with you. Like, don't open it before you get there. Don't drink it before you walk in, all that stuff. Also on the website are the instructions on not eating before the test and all that good stuff. Preparing for birth. So these are some of the childbirth education classes. We talked about method classes. Some of you are going for unmedicated births and some of you are just trying to avoid an unnecessary C-section. So we recommend having some sort of coping mechanism for when labor hits. These are, again, for informational purposes only. Hand to Hold, Birth Your Way, and Doula Banda all offer like hypnobirthing, hypnobabies, Bradley method. Supporting Her is a class for the partners. So dads and significant others who are out there who want to know what to do to not set off the powder keg that is the contracting pregnant woman, please take a look at that course because it teaches you how to effectively and not aggressively support when she is in labor. Next question here is, can we do at-home blood sugar monitoring? If you are diagnosed as a gestational diabetic, we will require at-home blood sugar monitoring. So yes, if you just want to do it for fun, sure. We have different ideas of fun, but I'm not going to stop you from doing something that you enjoy. But yes, it's not required though if you pass your glucose screening. If you mean instead of glucose screening, then you'd have to continue it for the rest of pregnancy. And it's easier to just do the one test one time. More preparing for birth. The breastfeeding classes that we mentioned are offered at the hospital. There are also classes by La Leche League, and there are certified lactation consultants around town who do breastfeeding classes before and after as well. Every new parent should know CPR. These are some links. One is just Red Cross. The other one is a mobile CPR class. She'll actually come to you and do it someplace. You and your girlfriends can get together and have a CPR class. Because if you already know CPR for adults, it is not the same as just doing it with one finger instead of using your whole hand. It's different for infants. Chiropractic care, if you're already seeing a chiropractor, good for you. If you're developing some pregnancy aches and pains and or want to just make sure your baby is appropriately aligned, make sure your chiropractor is Webster certified. That is a special pregnancy certification that takes into account the things pregnancy does to our body and make sure that we don't make adjustments that are harmful to the growth and development and positioning of your baby. Poll question. How many of you plan to work with a doula? I think at least my VBAC mama is. And then some of you are just really not sure. All right, we're closing the polls in three, two, one. Awesome. Oh, that's good to see how many of you are actually working with a doula. Yay. Okay, so more preparing for birth. Doulas. What are doulas for? You're like, I have a midwife, I have a doctor, I have a doula. Who are all these people? So certified nurse midwives are nurses first. They have their bachelor's of science in nursing, and then they went back to become nurse practitioners. So they have APRN, so advanced practice registered nurse. They're nurse practitioners, and then they had an additional master's in midwifery. So they are medical. So in some areas they can form as physician, they can perform as physician extenders in the nurse practitioner arena, and then sometimes they perform as these independent unicorn people that are midwives, experts in normal physiologic labor and care of the newborn. So they are part of your medical team. Doulas are there for emotional support and physical support. So if you are seeking unmedicated delivery or you're in some discomfort while you're kicking into active labor, doulas will help you find positions that are comfortable for you. Like they're not advising you on what medications you should be taking. They're not, advising you on whether or not you should take medical inductions or accept medical recommendations. That's what your midwives are for. But doulas are considered part of your medical team as well, and we encourage you to have them in your labor room. We encourage you to have them if you're having a belly birth as well, because emotional and physical support. Pregnancy is a wild ride, and they are your safari guide. Acupuncture and massage, those are, we have cards for people who are pregnancy certified. If you come in, when you're coming out of the bathroom in the front, everybody who's listed in that business card stack, we know does acupuncture and takes clients who are pregnant. The next slide, you can go ahead. Thanks. Breast pumps. Many of your insurances cover breast pumps. In every exam room, there are QR codes that you can scan. Please use the company that we provide for you. We don't get any kickbacks from that company. They just make it really easy for us. All we have to do is sign the form. They call your insurance company. They figure out which pumps are covered. They send them to you. You make your selection and report it back to them, and we don't have to do anything else. Y'all are finding some of these companies that are asking us, what your dog's name was in the fourth grade, and what your favorite color is, and it's too much information and too much work when really all we want to do is sign the prescription and get you your breast pump. So right around 20 weeks, around the time that you're doing your anatomy ultrasound, is a good time to scan that QR code. You'll have plenty of time to get the breast pump before baby arrives. And the double electric pumps, they have everything there. Postpartum care. So, for my moms who have any issues with blood pressure during pregnancy, we'll see you back before the 6 weeks to make sure your blood pressure is trending in the right direction. For my belly birth mamas, we'll see you back for an incision check. We screen routinely for mental health in the postpartum period. Also, to that end, consider postpartum doulas. I mean, if doulas are there for physical and emotional support, when do you need that more than right after a baby disrupts your entire house? The motherhood space is an exciting venture that is in full swing here in Jacksonville. Dr. Jill Garrett, the amazing Dr. Jill Garrett, has secured a grant. Jacksonville is one of only 5 or 6 cities, I think, in the country to have this fantastic resource, and it's kind of it's like a play date, a play space with therapy for new moms. So if you're having a rough go of it after your baby, please let us connect you to this fantastic resource here so we can keep our grant money coming and keep it alive. And then pelvic floor therapy, which is standard of care in European countries and America, not so much. Pelvic floor therapy helps with those sensations of heaviness and urinary leakage and all the things that nobody really talks about after delivery. But we have a nurse who comes in 3 times a week to do pelvic floor here in our office, and it will be covered. If you're covered by insurance with me, you're covered by insurance for pelvic floor therapy. So put everything back the way you found it. Like contents shift during travel, just like in the airplane. So let us help you get back to your new normal and make it as close to your old normal as possible. Random frequently asked questions. You may sleep on your left, on your right, on your back. Yeah. If you're waking up, nervous because you're sleeping on your back or dizzy, you want to get one of those wedge pillows from Amazon, stick it under one of your hips so you can't roll completely onto your back. That's fine. You can help paint the nursery. As long as it's well ventilated, you can wear a mask for it as well. Probiotics are fine in pregnancy. You can dye your hair, including your eyebrows. You can get gel nails. I would recommend a mask so that you're not breathing those fumes in directly in the salon. Holiday travel. This is my holiday crew. You can travel in cars up to 37 weeks. Don't recommend going more than 25 miles away from us after 37 weeks. Just be sure that you're getting out and stretching every 2 hours. And if you're drinking enough water, you will. For skincare, you can use your benzoyl peroxide, your salicylic acid, just nothing that contains retinol. If retinol is an important part of your regimen, you can use the natural alternative, bakuchiol, Bakuchiol, and it has the good properties of retinol and not the harmful properties for pregnancy. Flight is okay for my twins up to 32 weeks, for my singleton mamas up to 36 weeks. Please be sure you have a pair of compression hose on and that you're doing your toe raises to exercise those calves, drinking lots of water, and getting up to go to the restroom multiple times during that flight in order to prevent blood clots in your legs during flying. Things you want to avoid: roller coasters and water slides. Again, you're my winter crew, so this isn't as much of a deal as it is with my summer crew. Okay. I think the last thing we have coming up is just our COVID-19 update, and it's super short. We're almost there. All right. So ACOG moved from supporting vaccination status either way to strongly recommending. And I see a hand did go up. So if you have something, please put it into the chat and I can answer it there. Manufacturers that are okay in pregnancy are Moderna and Pfizer. We don't recommend Johnson & Johnson because it has an independent risk of blood clots, as does pregnancy. So let's not mix those two things together. All the vaccines are approved for booster injections. So if you're 6 months past your second injection of Moderna or Pfizer, you can get another of those. If you're 2 months past the Johnson & Johnson, you can get another vaccine, but not Johnson & Johnson because blood clots. But mixing and matching is okay. So you can get a Moderna or a Pfizer for your booster. If you're timing it against your flu vaccine or your Tdap, there's no optimal time. Like you can get them around the same time because they all work differently. And so there's no issue there. If you do contract COVID, there are no formal recommendations for ivermectin, azithromycin, or Plaquenil, and so we do not prescribe those. But the recommendations are for vitamin D3, zinc, vitamin C, and a low dose aspirin, 81 milligrams, and these are the doses that are recommended on there. At the time of contracting it, we would start monitoring baby's growth because contracting COVID during pregnancy does increase your risk for gestational hypertension, which can lead to growth restriction. If you contract COVID after 36 weeks, do not start the baby aspirin because you'll increase your risk of bleeding at delivery. Supportive at-home treatment at this point is recommended because it is a lot like a cold. So see our website for cold medications that you can take, the sore throat and all that other stuff. You only need to go to the hospital if you're having difficulty breathing or if you have a fever that you're unable to break with the standard normal amount of Tylenol in a 24-hour period, just less than 3 grams. All right. Next. So for, again, my moms who had babies during COVID last time, one, I'm sorry. 2, you can have visitors now. So 4 visitors, plus your DONA certified doula, because doulas are not considered visitors. They're considered part of your team, your labor team. We're not requiring masks in labor or in the room or in the hospital unless you are actively COVID positive at the time of your delivery. And even if you are COVID positive, we do not separate mom from baby. You're given an isolate so baby can stay in the room but not be exposed to your respiratory droplets. And we still encourage breastfeeding, especially because you can then confer immunity with your passive immunity. Okay, so last poll question: what information is found on the website? Birth plans, safe medications, what happens at each visit, or everything, because you are a super test taker and you read all of the answers. Fantastic. Polls close in 3, 2, 1. Fantastic. All right, we have another question here. Where's the power? Sorry, it keeps going away. Where's the power slide from this evening located on the website? It's on our YouTube channel. So you can go to our YouTube channel and you'll see this face, and you'll see today's date, and you'll know that it's the most recent one. So it's got the most up-to-date information on it. All right, thank you guys for rocking with me to the end. Remember, we are social, so please follow us on all the things. We are hoping to bring birth stories back because we are having some fantastic ones at our new facility. Mamas are loving those tubs and the wireless monitors, and we're doing VBACs just like we always were. We are still full circle circling the way full circle always full circles. And we're going to keep doing it. So thank you again for joining me. Thank you for trusting Full Circle with the addition to your sweet families. And I look forward to seeing you all in the office very soon. Mwah. Love you all.